Into your health, someone will die from heart disease in the U.S. in the next 39 seconds.
It is the #1 killer, and a man who had to deal with heart issues shares his story. News 2's John Pastorek begins a series called Reduce Your Risk.
Heart disease can ruin your retirement. It almost happened to a Clinton man who was dreaming of a great motorcycle adventure in the American West. But that great adventure almost turned into a great tragedy when he had a brush with heart disease. And he's sharing his story to help others reduce their risk. When Randy Russell straps on his helmet and climbs on his motorcycle, it happened.
It's just the freedom. It's the excitement of seeing new places.
But as the 62-year-old retired plant worker and his wife Sherry were preparing for a great retirement adventure in the West, something took him off the Harley and into a hospital bed when he started having strange symptoms.
Just a funny feeling. It's hard to explain. I think the nurse did a good job a while ago, maybe a flutter. It doesn't hurt. It's not a pain. It's just something that you don't normally have.
Randy has a history of heart disease. His father died of a massive heart attack. All of his brothers have heart problems. Randy's even had heart bypass surgery, so he wasn't taking any chances. He underwent a transradial heart catheterization. Most caths are done through the groin. This one through the wrist.
30% lower risk. Patient sits up 10 minutes after he's done and can eat and walk around and go to the bathroom. You're not laying down on your back for 4 to 6 hours.
Dr. Charles Thompson inserts a catheter and guides it through Randy's veins to take a look at his heart. And he discovers the problem. A vein used as a graft in Randy's bypass operation is blocked. 99%.
So the whole graft is subtotally closed. It's not a good blockage to try to do.
So Thompson inserts a balloon and a stent to open up the vessel. And in just seconds...
And now you see how fat it is with the stent deployed right there. Well, we've totally fixed this vessel. There's always the small chance that it can clot off or have a problem, and that's just random acts.
Randy could have been the victim of a disease that kills more than 10,000 men and women in Louisiana each year. Many deaths that could be prevented if victims would listen to their bodies and not ignore symptoms.
The biggest tragedy about heart disease is that 99% of people, when they have a heart attack, die within the first 45 minutes of the onset of pain. But the average person waits 12 hours to come to the hospital.
But Randy didn't wait. He listened to his body.
Relief. Relief. It's better than having a heart attack.
He has as much risk of having a heart attack as any other man his age. So he just needs to go and live his life and not worry about having a heart attack. Watch his diet, take his medicines, exercise, and love y'all, and enjoy every bit of life he can and not worry about it.
And that means shining up that Harley and getting ready for his great adventure west, where he'll find freedom on his bike, now that he's found freedom from a possible heart attack.
It's going to mean a lot. Knowing that I was probably that close to a heart attack, it's going to make me feel a lot better. I'm going to relax.